And welcome to the afternoon session. We're going to hear about Lipids point-of-care testing project that we've done delivered recently. And I think the first thing I want to do is just give some context onto why we did it in the first place. And I think we did point-of-care testing and health checks project in the community because of a reason. Now, health innovation networks have been driving and supporting cardiovascular health prevention and making it better, helping to optimize patients for the last 5, 6, 7 years probably. But I think a lot of that has been with working with primary care, working with existing services. And the problem with that is, while it's absolutely brilliant, that's working with the patients that you already know and you already have data on. So you can see on a primary care record if somebody's suboptimally managed for blood pressure, hypertension, or cholesterol. Their cholesterol is too high, they're taking a statin, they should take more statin. It's kind of fairly easy to call somebody in to kind of try and optimize that with an individual, isn't it? But what about community? What about the people who are less engaged with primary care? The problem is it's not the people themselves, it's do the services that we currently commission, reach everybody. So whether communities are underserved or seldom heard, there are lots of phrases, words that are used, but our service is right for the people that we have, and our service is right for everybody that we have in Greater Manchester. That's the key question, and that's why we've done some community-focused work. So doing something in community is great, isn't it? But doing stuff in community and doing things to community isn't so great, because you're not really sure if you're doing the right thing, because you're not working with communities. So I think the point of this, it's a really good example, I hope, of a project that we've delivered recently, which is a project which has been co-designed in partnership with the voluntary sector organizations that represent the communities that we've been working with. And the communities that we've been working with, we've identified through data because they're potentially at higher risk of earlier onset of poor cardiovascular health and that kind of stuff. We did some work beforehand. We got some money at Health Innovation Manchester, and we formed relationships with community partners called the STF project. And that was absolutely brilliant. But a lot of that focus was on engaging communities and educating communities about the relevance of cardiovascular health, not necessarily checking them. So blood pressure checks, checks for cholesterol, lipid checks is this project. And that's the absolutely key bit of it, I think. Like finding people that need health checks. I know we have NHS health checks, but you have to go to primary care and you have to be 40 plus for those. So health checks offered in community settings for anybody that is potentially willing to be engaged in that process. So I'm just going to go back. So we've got all our partners that we've worked on in the project here this afternoon, and they're going to be talking. So it's not going to be me, it's going to be the people who delivered the project, which is absolutely the key bit. So we've got Nana from Manchester Local Care Organisation, Donna, Director of Policy for Black Health Agency for Equality, Shola, Deputy Head of Delivery Services for Caribbean and African Health Network, Salima, Project Manager, Winning Hearts and Minds, Nick, Winning Hearts and Minds as well. And then we're going to have a community engagement session talk from Nikki Timmis and a bit of a Q&A this afternoon to finish. So at that point, I'm going to hand over to my wonderful colleague, Nana.